that you're pregnant and practicing being a dietitian, what do you practice now that you've always preached?
Being pregnant is an amazing responsibility. As a practicing dietitian, I'm now practicing some of the things that I've been telling my clients for years. So what I really try to do is plan frequent meals and snacks, take my prenatal vitamin, and eat a variety of foods so I get all the vitamins and minerals I need from my food.
So how are your meals and snacks different now that you're pregnant?
Pregnancy requires a little more energy, so you need about 300 to 400 more calories a day. I try to eat every couple of hours, every 2 to 3 hours, so that I'm getting all the nutrients that I need. Each meal or snack I try to get some proteins, a lean source of protein, and that also helps me from getting
I'm also trying to choose a variety,
especially in
my
first and last
so that I get all
trimesters.
the different flavors and tastes.
I also try to get 3 to 4 servings of calcium. I usually try to plan ahead and get some meals and snacks available for me all the time so that when I get busy I can just grab one on the go. So I'll usually at my desk you'll see things like granola bars, fruit, yogurt, cheese snacks, things like that.
So what's the difference between a regular multivitamin and your prenatal vitamin?
A prenatal vitamin has higher amounts of iron, folic acid, and can sometimes have higher amounts of calcium, and also omega-3 fat called DHA and EPA that can be helpful for your baby's brain development. You need higher amounts of folic acid, especially in the very early weeks of pregnancy, to prevent neural tube defects. So if you're thinking about being pregnant, you may want to go ahead and consider taking your prenatal vitamin now before you get pregnant. But talk to your doctor about your specific needs.
So I heard you have to avoid some kind of foods when you're pregnant, like sushi. Is that right?
There are some food safety rules that you want to abide by when you're pregnant. First thing that you want to do is make sure all your meats are cooked properly to proper temperature. So that would mean that you would want to avoid any raw fish. There are plenty of types of cooked sushi that you could partake in them. You also want to make sure that with your lunch meats that you heat them until steaming before you eat those. Make sure that you check your best by dates on your products and adhere to those. Watching to make sure that your soft cheeses and drinks are all pasteurized. You don't want to eat anything that's not pasteurized. Sometimes your brie and your feta cheeses are not pasteurized. By following those best food safety practices, you can reduce your risk during pregnancy when you're most vulnerable.
How much weight gain is healthy during pregnancy?
The average woman will need to gain between 25 and 35 pounds during pregnancy. The second and third trimester are going to be about 1 pound per week, and only a few pounds, maybe 5, in the first trimester. If you're overweight or underweight, you may have a different amount that you need to gain. You want to go by your physician's recommendations. The best thing to do is to focus on slow and steady weight gain. This can help you prevent stretch marks. It also helps you lose the weight that you gain in pregnancy, and you don't want any big jumps in weight gain either. Maternal weight gain has recently been linked to obesity rates also, so more moms with excessive weight gain in pregnancy links the child to obesity later in life. So while you do need extra calories in your diet, you don't want to overdo it.